Hi, this is Dr. Sean Benzinger, and today's seminar is on arthritis, the catch-all diagnosis. If you've not had the opportunity to see one of our seminars in live, you know that we're going to give you not a watered-down version, just the basics, and not go off on so many diatribes that sometimes I have a tendency to do. For those that have not been part of our system before, we're trying to find a way to educate you to learn how to take care of yourself at home. Bottom line. That's what we're trying to do. If you've not registered for the free newsletter at secondopinion.org, please do so. Primary reason is every single week there'll be 2 or 3 brand new video pieces as well as articles that will be brought up covering the topic of that month. And hopefully we'll update you, allow you to educate yourself, and allow you to help friends and family members that are suffering from disease processes. Our goal is to teach you how to take care of them yourself as much as possible. And then when you have to have a physician's help, that you know exactly what you're looking for, and you know what questions to ask, and you know what condition you have, and you kind of know what to do for yourself. All too often right now we're walking away from a doctor's office without a clear-cut understanding of what I can do and how important it is that I do what's necessary to help myself get better. So arthritis, the catch-all diagnosis. 70 million Americans affected, 1 in 3. Huge numbers. Women are twice as likely to get arthritis in general as men, and 39 million doctor's visits are just associated with arthritis. Over half of them are osteoarthritis. We're going to break that down later into our seminar. And most develop osteoarthritis after they're 45 years old. Rheumatoid arthritis and gout are tied for second and third place. And rheumatoid is usually more women associated, gout more men associated. And always think of your big toe when you think of gout, because that's usually where a lot of the symptoms come from, but it doesn't always have to show itself that way. Over 250,000 children are affected by this traumatic disease. That is a huge number, okay? Causes, heredity, 5%. Let's not jump to the 60%, gee, everybody else in the family's had it, so I'm going to have it situation, because guess what? That is not the situation. Fortunately for us, heredity plays a small role, and still how we treat ourselves and take care of this vehicle that we were given makes a huge difference on what's going to be exposed at what age group and how bad it will be when it's exposed, okay? Age. As you get older, osteoarthritis. Rheumatoid and other types of arthritis can affect you younger. In fact, juvenile arthritis can be age-related. Overuse of that joint over time. I can tell you that I've got this hip that's not in the best of shape from pushing off on a pitching mound for 18 years. Not the best shape. And this left leg that I would step onto and put a lot of pressure on over the years isn't so happy, and neither is this shoulder a whole lot. But the truth of the matter is, I don't have many symptoms at all, but I know on occasion when I'm overly tired and have some issues, that's what's going to show up, and I know it's overuse because I've looked at the x-ray down here on this hip, and let me tell you, I just don't have the space that I used to have in that spot. Now, does that mean pain? No. It just means it doesn't look too good. It's like gray hair and wrinkles. Arthritis can be a non-painful condition if taken care of, and if we can control the swelling and what irritates it, guess what? We've got a whole new ball game. If you looked at the x-rays on my knees, you would wonder, he must really be hurting every single day. I can tell you, except for excessively tired and the other reasons I've quoted you, I don't really have a whole lot of pain in my knees, but it's because I control the inflammation and other causes, and that's what we're going to talk about today also. Injury. Many of us had injuries. We talk about the injury for years, over and over, how, you know, it's this injury from football, it's the injury from wrestling, it's the injury from. The truth is, except for bones, most of your body turns over every 3 to 5 years. Many times injuries haven't been treated right, coordinated properly, balancing of muscle groups, joint mobilization issues. There's lots of compensations that go on in the body that many times you can do things about. And we want to encourage you to know you can do things about it. Infections, odd causes, does happen, not frequent. We're not going to cover it a whole lot. But what's the indication of arthritis? It affects, frankly, a particular joint. In the joint itself, often is painful and frequently results in a loss of movement. Just can't, like I cannot get down in a catcher's crotch all the way on this left leg. It's about 15 degrees loss. And if you looked at it, it's pretty close to bone on bone from all the damage that I've done. But overall, again, I'm able to exercise, stay fit, and do what I need to do with no pain. And that's the key. Right now, no pain. Most types have some sort of inflammation around because it's damaged. And when the inflammation comes is usually when the pain comes. And many cause other conditions to result in compensation to it. And that's some of the things we're going to try to attack, and then you know what's what. You'll also see other seminars, stress and back pain. You'll see back pain, fibromyalgia, osteoporosis, and a few others that hopefully you can pull up and actually get a view of, because you never know which one you have. And most of us have a combination of all of them, and that's what makes it really difficult. Okay? We live in a world in which we're trying to find a specific way to try to pigeonhole you, so we have these medications or something to treat you with. The truth of the matter is most conditions have overlaps into other conditions, and you need to know that. Okay? So some of the joint information that's interesting is when you're pregnant, by 4 months, your baby's joints are formed and working. Adults have about 206 bones, so you got a lot of opportunities to have arthritis. And cartilage, which is that cushion between the bones, is about 65 to 85% water. And cartilage is the best known shock absorber known to man. We've never been able to duplicate it. And for those runners, I'm not trying to pick on you, but you need to know, running can increase pressure in your joints up to 10 times your body weight, period. That's why runners that run from the time they're very young, usually over a period of time, eventually they can't keep running because it just wears out the joint complex. Runners that start in their 30s or 40s many times run for many years into their 60s and 70s, just depending on what's going on. We really think biking, walking, swimming, aerobic exercises like that seem to be better, but I know when you're a runner, you'll hear this, the ears turn off and you go, I can't stop that. But just remember, we want you to do things for a lifetime, not just for 10 or 20 years. Okay? Types of arthritis. Osteoarthritis and rheumatoid arthritis, those are big two that we're going to cover because that's the majority of arthritic conditions. Gout, ankylosing spondylitis, you definitely don't want to get that. Infectious arthritis, juvenile arthritis, psoriatic arthritis related to your skin, and then also you can have it associated to the joints themselves from an immune-based disease process. And others, Lyme's disease, scleroderma, reactive arthritis, and lupus. And lupus diagnoses seem to be going up in the society right now for some reason. We'll cover that probably in the next few years. Arthritis companions, carpal tunnel syndrome. Well, I never thought that my carpal tunnel could be related to arthritis in the joints. Sometimes a doc will see the carpal tunnel, see the nerve damage, and say, well, we need to go in and fix that, and forget to mention that you got 50% loss of one of the bone-on-bone situations here. Tendonitis, elbows, knees, hips, bursitis, fibromyalgia. We see a lot of diagnoses with that. And we have a special segment just on fibromyalgia. So you might want to pick that up. I think it'll help educate you. Myositis, which is inflammation of the muscle, can constantly occur over and over again because the joint itself is struggling so much to function, as in an inflammatory state, and is really struggling to function well. All right, false claims. And this is for the more alternative health care issues as well as the aggressive therapy issues. And the reason why I bring this up is because they'll be oversold that a single remedy seems to fix all. I found all too often that usually is not the case. So when somebody says it's a miracle cure and it can help everything, you got arthritis, you got a joint problem, you can't think straight, whatever. And then they always have the secret formula that nobody else has, but it's always natural. Okay? So am I bad-mouthing these organizations? Absolutely not. Truth is, they usually have a very, very good quality product that works on specific areas very well. But then they try to expand it because they heard somebody in Timbuktu that called in and said, hey, by the way, that helped with the warts on my finger. Well, all of a sudden now it seems to help warts. The truth of the matter is, secret formulation is another thing to stay away from. And when somebody comes up to you and says, and frankly, all you have to do is pay that $1,000 up front and you get all this product line, start running, try it for 90 days, see if it helps you. If it helps you, then look at it further with our other product lines and see if it really does help you or somebody else in your family. You're going to find a certain number will be benefited by certain types to a point. because usually it's very focused on a specific area. And the cost. If it's very, very high and that's the only thing you can afford, unless that one thing fixes everything, I would shy away from it. So just keep that in mind, okay? All right, osteoarthritis. Signs of it: joint pain, weight-bearing pain. So here I am, I'm standing in front of you and I'm giving you this discussion. And if I'm starting to hurt, ache, let's say on this left knee, I've had it multiple times in my lifetime, and I sit down, and for just a temporary period of time, you can feel that pressure come off almost immediately. Osteoarthritis is more likely to be the inducer than other types of arthritises. Joint stiffness and difficulty moving the joints, like sit for a period of time, then you get up, and it takes a while to kind of get it looser. Osteoarthritis might be part of that. And swelling in the joint or possibly around the joint, because there's so much swelling in the joint, it can overflow into the other tissues. So that's some of the signs of osteoarthritis. Now here's the most important components, okay? The cartilage, remember, it's something that man has never been able to replace, okay? It's 65 to 85% water, and it's a great shock absorber, but it needs replenishing. So for those that think that water is a foreign object from other countries, and you think orange juice and coffee and alcohol and other things are going to substitute for it, you're just terribly wrong. In fact, at night, what really happens is this, and we're going to skip kind of 3 down to something called proteoglycans. These things are like little sponges that are interwoven into this cartilage, and actually it imbibes or drinks water at night. In fact, the discs were a little bit different type of tissue, but a lot like cartilage, okay, just has some other flexible tissue in it. You'll actually gain height. So if you want to check your height, you check it in the morning. You don't check it at night. If you need to be short, I don't know why, but maybe you need to be, at night, it's the best time to check it because you'll be a little bit shorter. Isn't that odd? But that's how the body works. You just kind of like the pressure of gravity keeps wearing on it and wearing on it, wearing on it. And at night, if you have plenty of water that you've drank all day and you keep it replenished, guess what? You're going to get a little bit of imbibing at night and you get a healthier joint complex. But if you don't get it replenished each night, these proteoglycans and this collagen doesn't get enough water in it on a consistent basis, think of what happens. It's common sense. That's going to wear down and wear down and wear down when it doesn't have that elasticity or that fluid in there to help it. So keep that in mind. Water is a key component. Collagen is part of it, and then there's these chondrocytes and chondroblasts. What do? They break down old. If you've seen our osteoporosis seminar, you understand cytes and blasts. And the reason why it's so important is cytes and blasts. Cytes actually break down older cartilage and then the blasts put on newer cartilage. So it remodels and makes you new all the time. Remember I said over a certain period of time your whole body changes over with a different cell structure. So guess what? Taking care of yourself over a long period of time warrants a better and better health condition. I've had many patients that will tell you, I'm healthier now when I'm 50 than I was in 20s, 30s, and 40s because I'm exercising, I'm eating right, my lifestyles are together, I take vitamins, da-da-da-da-da-da-da. And the stress that was killing me is out of my life. And usually it's an X. But anyhow, hopefully it's not. What's it feel like? The joint, it's painful. It's stiff, loss of movement, and it can be tender, and there can be some warmth around that joint itself if it's pretty severe. And cracking joints, not cracking tendons, but cracking joints can play a role in this. And if you've been to the doctor and you see bony outgrowths on the x-ray, that's not uncommon either. But if in fact there is degenerative changes in the fingers, you'll see increased nodules in this area, right here, okay? While rheumatoid arthritis is usually here, the distal or further away, these are usually here and a little bit here in which you see these big knots, kind of like mine. Mine look pretty big. I would think I would have a tendency towards osteoarthritis way before I'd ever get rheumatoid arthritis, just because of that pattern, okay? Is that always correct? No, but it's an indicator. Just keep that in mind, indicators. Root cause, I'm going to kind of cover a few other factors associated with joint injury itself. That traumatizes things. And when you're a kid and do it, it's even more of an issue. And remember, we have up to a 30% increase in fractures in kids in our society that really affects osteoarthritis years later. Why? They're drinking sodas instead of milk. They're eating junk food instead of cheeses, dairy, solid grains, fruits, and vegetables as we did years ago. And now we're seeing fracture rates elevate. Is it because now we can evaluate it better? I don't think so. I actually think half of it's got more to do with that the kids' bone structures are softer than they used to be. Boston University physician came up with that. I think she's right. I think that that's what's happening, and I think that's something that's got to be dealt with at home with a better diet. And it doesn't matter if they don't like all the things you will fix. It matters that you do what's necessary to help them feel better. Okay? Repetitive motion. Somebody who's in the checkout line and they're doing it and doing it and doing it and doing it, you can wear out the joint structure itself. Sometimes people have to change jobs. In my occupation, people many times can't withstand it because of back problems, shoulder problems, wrist and hand problems. Construction, carpenters, they really are hard on their systems. And damage to the end bone itself because of fractures that weren't taken care of right, bone disease itself, too much weight. Here's where obesity over a period of time puts excess weight on all the joint structures to a point where it can actually irritate osteoarthritis and advance it further, okay? Because you're putting more weight and more gravity on it. Remember that spongy replacement of fluid thing? The more weight you put on it, the harder it is, okay? Food allergies. Oddly enough, food allergies over a period of time cause increased autoimmune-based conditions that can advance arthritic conditions. And a diet high in animal fat. If we like steak and potatoes every night, and that's just what we do, guess what? Osteoarthritis, here we come. You're going to get there faster than most people will, and you got to keep that in mind, okay? Emotional stress. Oddly enough, emotional stress affects the immune system and can affect the osteoarthritis patient, okay? Hormone imbalances, more covered in osteoporosis as well as fibromyalgia and a few other things, but does play a role in this one. And biomechanical. Bad biomechanical structure. Got a bad posture all the time. You're carrying your weight forward. Your body just can't withstand those things. Posture plays a big role in osteoarthritis in the spine. Special note to women, and I think is really important for you to kind of put into your ballywhack and get an understanding of, because there's more and more evidence like this coming out. Canadian researchers looked at the association with arthritis and synthetic hormones. If you used them for 5 years or less, there was an increase of osteoarthritis twice as much. If you've used them more than 5 years, it's demonstrating a 96% increase in arthritis. So those that use the pill for appropriate reasons, but we've got kids at 14, 15, and 16 are being put on the pill to correct their menstrual problems before they've tried conservative approaches to try to take care of it, which usually has a lot to do with diet, certain nutrition, and possibly progesterone assistance. And if you look at our hormone seminar, it covers that in depth, or look up CarolynDean.com, Carolyn Dean, C-A-R-O-L-Y-N, Dean, D-A-N.com. And she is an MD that has specialized in this for many years and could give some great advice. I highly recommend it, okay? Because it isn't just osteoarthritis that the pill predisposes you to. So keep that in mind. Not just that. There's lots of other things you should be concerned with. So let's find out what works. What's going to help you? Hot packs, cold packs. Those are successful in certain cases, mostly if the knee is hot or the hip is hot or the back is hot. Cold sometimes really works, but for some people, hot's the only thing that seems to help. But remember, if it's swollen and you put hot on it, sometimes you have a tendency to make it swell even worse. If you're one that doesn't swell much, hot might be the only thing you have to use. Massage. Fabulous. One of the best things you can do is get those massagers for $40 at one of the Walmart or at Brookstoner's or some of those places with the two heads on them that penetrate. Those are wonderful if you can't get your spouse or a friend to massage you on a consistent basis. Hot tubs are remarkable. Here's a caution. Really important, okay? Hot tubs with men that are in the age group in which they're trying to have children can lose sperm count up to 80% loss if you use a hot tub all the time. Sometimes it's just the man reducing their sperm count because of a hot tub use all the time. That it should be something, it's just a side note, but important for you to know. TENS unit, trans electrical neural stimulators, I find they help in 5 to 10 to 15% of chronic pain. I don't find that they work as well as we were told in the beginning, okay? Chiropractic adjustments, osteopathic adjustments, sometimes with osteoarthritis, just keeping that joint mobile with that type of manipulation is the only thing that really helps. Osteoarthritis and chiropractic work together pretty well. Biofeedback for stressful situations or high pain. We know that getting in deep breathing techniques such as stress reduction techniques We can reduce 50% of our pain. 50%. I'm going to say that again. 50% of our pain can be controlled just by deep breathing and relaxation exercises. So those exercises that you go through, breathing exercises to deliver a baby, ladies, is very productive in reducing your pain from headaches, osteoarthritis, or other types of symptoms. Keep that in mind. And nutritional support to decrease anti-inflammatory tendency and rebuilding tissue that's been damaged. Very important. So we know vitamins and minerals are essential in this situation. Acupuncture, when you've dealt with it on a chronic basis, has some really beneficial side effects. So you might want to consider vitamins and minerals and acupuncture as something to use. Herbs, there's a few specific herbs, we'll cover them later, that I think are remarkable for decreasing swelling, because right now we're having a hard time finding medications that are anti-inflammatory, that are safe, that are not causing other disease processes. And you've got to remember, we're losing over 16,000 people die of side effects of using NSAIDs, NSAIDs, over-the-counter anti-inflammatory drugs. That's the federal government studies that are showing this. And so you really have to be careful in these situations. Homeopathics can be used on kids, can be used on older adults. Doesn't interfere with medications. Homeopathic's been used for hundreds and hundreds of years, very safe. And if you're a believer in trying that, I think it's very helpful. Tai Chi, motion type exercises. I can't tell you what motion type exercises, smooth, easy exercises do for the pain and loss of motion that occurs from osteoarthritis. Magnetic therapy has been demonstrated to have some benefit with certain people. Trial and error, that's what it is, unfortunately. Aromatherapy, that's essential oils that are breathed in that have specific medicinal benefits. And the French use it a lot, the Germans use it a lot, some of the English. We're just starting to delve into it here, seen some very good benefits from it. Botox, you might find that kind of surprising that I would mention Botox. We just don't see problems with Botox. We just don't see side effects. But Botox with chronic pain seems to be working. Remember, it's not permanent. It's usually going to work 3 months, 6 months, maybe a year. But that might be worth it since there's minimal or no side effects and seems to be a possible alternative when nothing else conservative is working. Yoga and non-weight bearing exercises, biking, swimming are phenomenal things to use. Okay? Most common medications, here they are. NSAIDs, okay? Aspirin, ibuprofen, naproxen. Naproxen is supposed to be the safest of all of them. Make sure you protect your tummy. Oh, I take it with food, doctor. Too bad. Take some Tums. Ask your doctor for something else that's a protectant to the lining of your stomach if you're going to use this on a chronic basis. It can save your life. And we know that it has a negative effect on kidneys. In fact, what's interesting is it might have a local anti-inflammatory effect. It seems to have a general inflammatory problem and really is hard on your kidneys. So long-term use is an issue, and many of you are doing it. I mean, you're popping 2 every day. That's what gets you through. It's the only thing that helps. The problem is it's not meant, look at the bottle, it's not meant for long-term use. And talk to your doctor about all the other alternatives. There are herbals, homeopathic, and certain nutrients that do seem to help in these cases. And your diet plays a massive role in swelling. Acetaminophen, watch your liver closely. And if you're on statins, watch it really closely. Some of the recent research coming out with babies that have temperatures, that if they use the bottle recommended acetaminophen dosage to keep the temperature down, that after a 7-day period of time, 30% are in toxicity. Liver toxicity just with acetaminophen in a baby. Now think what's happening with some of us old codgers that have been using all kinds of things and eating certain ways and not so healthy. And now we've got statins to lower our cholesterol, and we happen to take Excedrin or some type of medication with acetaminophen every single day just to control the pain so we can work and go from there. That liver is taking a whopping, and you should be very careful. Very, very careful. Long-term use, real big question mark, okay? Foods to avoid: red meat, eggs, saturated fats, okay? Bad oils, French fries, things like that, fried foods. Sugars elevate your inflammation. Just know you're going to be a high-carb person, lots of rich white flours, lots of sugars. Guess what? You're going to have more inflammation than the average person. You're going to hurt more often, more than likely. Dairy, many of us are allergic to it. Don't know if it's something in the milk or not. You might want to look at the possibility of getting milk that is fresh from the cow if you have a state that allows you to do so. refined carbohydrates, and gluten-filled foods. That's the protein in certain things like wheat and barley that some people are highly allergic to. I will have patients that we won't find it for 30 years. And then they always had GI problems, but the reason they came in was neck pain or back pain or chronic pain because I ran a chronic pain center for 10 years. We ended up finding out they were gluten sensitive and they ate wheat products all the time, causing general inflammation in the entire body. Here's the thing you got to keep in mind. Inflammation in general is a general issue. Inflammation in general is a general issue. You don't just get it in one spot. It affects the whole body and can cause other symptoms that you chase around treating while the cause is somewhere else. Keep that in mind. It's pretty frequent. And what we put in our mouth plays a major contributor to how healthy or how unhealthy we are. Caffeine, excess caffeine. Got people who take vitamins and they drink their coffee with it. Do I have a problem with coffee? No. Do I have a problem with a pot of coffee a day? Yes, because it can interfere with your absorption, and excessive alcohol over 1 or 2 ounces a day is always a consideration for concern. Allergic foods, they're special to you. I can give you a list 2 miles long, and guess what? It'll affect some of you and not the others. Okay? It's trial and error. Take the foods you eat most common that are most likely to be food allergies. Dairy, wheat, things along that line, caffeine and rich white flours and things like that. Wipe them out of your diet, go 30 days, and then for 1 day you eat just that food all day long. Wheat all day long. See how you feel. You will be amazed at the energy you'll get during the time that you're off of allergic foods and when you go on, how it affects you. Well, guess what? It affects your joints too. Nightshade plants, potatoes, tomatoes, peppers, eggplant. A lot of people hear this and they cringe. A lot, okay? Is everyone affected by this? No, but white Caucasians have a much greater problem with nightshades. Scottish Irish, major problems with nightshades. They think it's some genetics factor that seems to express itself with chronic use of potatoes, tomatoes, eggplant, and peppers. Many of you will say, well, I'm fine with the peppers, I'm fine with the eggplant, but don't take my potatoes and tomatoes. That's all I eat all summer. You might find you hurt more. And if you do, assess it. Okay? Here's some of the foods you can eat that make you better. Okay? And later on, we're going to be covering rheumatoid arthritis. Interesting enough, almost all the foods are the same. Anchovies, apples, broccoli, cauliflower, curry, fish and flaxseed oils for inflammation. If you have a tendency towards inflammation, you carry extra weight, you can tell you're always kind of carrying extra fluid. Lots and lots of fish oils and flaxseed oils are very, very healthy for you. Okay? Garlic. Excessive amounts of water. Remember, we want to rebuild what we do have and get it working. Grapefruit and other citric fruits can be beneficial, and in some cases, if you have an inflammatory tendency, not just osteoarthritis, these might be ones you have to stay away from. The other thing is grapefruits interfere with many medications. That's a side note, but keep that in mind. It interferes with many medications. Keep that in mind. Grapefruit. Grapes, mangoes, nuts, all but peanuts. I recommend against peanuts just because they many times carry a toxin called aflatoxin B and should be kept away from you, mostly if you have any cancer tendencies. If you have cancer tendencies, peanuts should be off of your diet, period. Every text I've reviewed, every author that's written about it will tell you aflatoxin that is carried in fungus that is often found in peanuts is pro-cancerous. Interesting enough, isn't it? But not pecans, almonds, and lots of other things, okay? Peanuts, okay? Oysters, papaya, spinach, and all kinds of greens and whole grains are very, very healthy. Whole grains, okay? Now, the federal government had to put down, actually had to write up what whole grains were because the manufacturers, for some reason, just couldn't figure out a whole grain's a whole grain. They somehow would just cut the shell off and do a few other things and hand it to you and say, gee, it has a whole grain in it because they put a little bit. Whole grain means everything. The grain, the germ, the covering, which has all the nutrition in it, whole grains. You have to really look closely, okay? Here's some of the nutrients to consider. Glucosamine sulfate or chondroitin sulfate. Chondroitin is actually a precursor to glucosamine. Now here's one thing I want to mention. Unfortunately, it's expensive stuff. If you're paying under $25, unless you have a special situation or you're taking a very low dose, more than likely you're taking one that's been cooked and often is unusable. Again, tune in to our website. Over the year, we will be laying out these guidelines so that you get a better understanding of what you're buying and not buying and why, because you don't know, and that's my job. And there's a lot of other people trying to do this too. We're hoping to get you clearer ideas so that when you do put money down on the table, it's got some value and purpose and can help you heal and be healthier. Okay? Because here's the whole thing. You can control it with these things that have no side effects. Guess what that really means to you? A whole different lifestyle controlled by you. You. And that's what we want. Anything that we can do to make you be able to take care of yourself at home, isn't that what we're aiming at here? Okay? Fish oils, again, we've mentioned that before. Multiple vitamin and mineral. If you're not taking a good quality one that doesn't have dyes and binders and junk in it. You see number 3 red and number 3 this. Heck, you look at Flintstones, and unfortunately some of the kids' vitamins, shouldn't have said Flintstones, but the kids' vitamins, they have MSG in it. MSG was taken out of baby food in the 80s because of this MD, John Olney, that fought in Congress for 8 years to get MSG removed because it affects the brain's development. Okay? We said, well, fine, we'll make sure the kids don't have it. Now they're putting it in the vitamin, but they're not telling you anything about it. I don't know if that's illegal or not. That's a big question I need to find out. Is that illegal to do when children are not supposed to have MSG put into their food groups? Okay? Anyhow, MSM, special nutrient that's helpful. Betaine hydrochloric acid and bitter herbs that are used by lots of other foreign countries are great for digestion problems. Bromelain, grapefruit seed extract, niacin, watch the flush. Niacin's a great nutrient to get blood flow to those cold hand, cold feet people. Rheumatoid arthritis and other types of disease processes really benefit from niacin, not niacinamide, niacin. The problem with it is you have to start with really low dosages and work up until your body can handle it, because it dilates blood flow to your skin and your hands and your feet. And by doing so, if you take too much, you'll get really beet red and feel like you're going to pass out. So you have to be very careful. Is it dangerous? No, you just drink water, it gets out of your system, it doesn't hurt you. But the point is, the passing out and falling down might be the catch. So niacin, slowly work up to. SAM-E, another great osteoarthritic beneficial nutrient. Selenium and vitamin E have shown great benefits in decreasing inflammatory issues and a great antioxidant. Okay? Some of the others, ginger, devil's claw, white willow, which by the way is aspirin. You know where else you get aspirin? Strawberries. That's where aspirin used to come from. Okay? Alfalfa. Here's the thing you have to realize. Over 80% of any medication that's ever been created or ever will be created was found in nature first, duplicated in a lab, and sold to you. Now the question is, they found it did all these things in nature. Why didn't they just give you that and sell it to you? Cheaper. A lot cheaper, wouldn't it? When you think? But I guess you can't make big money on that. Pet peeve, okay? It's a pet peeve. Yucca root, boswellia, great anti-inflammatory. Plant sterols, if you've seen our cholesterol seminar, plant sterols are one of those things that if you get it in the right type of margarine, most margarines don't have it, you've got to say plant sterols, also have a beneficial anti-inflammatory effect. And curcumins, okay, are very, very helpful. That's more like foods that are fed to you in Pakistan, India. Indian foods have lots of curcumins, okay? Very, very healthy. General mineral, vitamin C, boron. Boron, if you have osteoporosis and osteoarthritis, be a key element for you to consider. It's only a small element. You only need a little bit of it. Chlorella, DMSO, and arnica gels. Can't say enough about these. These are topical gels, and if it's in your low back, it's kind of hard because it just can't penetrate that far. But elbows and knees and shoulders and necks sometimes, DMSO is a great anti-inflammatory, arnica, great painkiller, and they seem to have no major side effects unless you have highly sensitive skin. Good topicals. There are menthol, there's salicylates, and capsaicin out there too, but I like these. DHEA helps promote your body being able to make, in the adrenal glands, it helps it make estrogen and testosterone. For ladies that have been through hysterectomies or are having problems with balancing hormones, DHEA can be a possible nutrient, but I suggest that you get advisement on that before experimentation, okay? Rheumatoid arthritis. We're going to cover some of the specifics associated with this that make it a little bit different because it is unique. Your immune system attacks the membranes that keep the fluid inside your joints, and the entire joint swells up. Then your body actually attacks itself over and over by mistake, thinking that it's attacking a foreign body, but it's actually attacking, if this was one cell and this is the other cell, and here's your immune system looking at something that's really your cell. For some reason, something went awry that triggered your immune system to start attacking itself. That's rheumatoid arthritis. That's also lupus and a few others, so keep that in mind too. The joint space narrows over time. The joint deteriorates, becomes weak and misaligned, and there's usually a lot of pain associated with it, okay? So signs and symptoms: pain, warmth, redness, and swelling. And that's a little bit different than osteoarthritis. If it gets much warmer and redness, that might be rheumatoid arthritis. And remember, rheumatoid is going to be down here in these joints if you have that sign, while the osteoarthritis will be up in these joints a little bit more, okay? So joints affected, usually RA is going to be on both sides too. You can have osteoarthritis on the one bad left knee, let's say, but rheumatoid, you're usually going to have both affected. It's painful, stiffness, and it lasts over an hour or more in pain, and most people will tell you that they often have low-grade fevers for no apparent reason, and because of that achiness, soreness, stiffness, they end up with difficulty sleeping. And unfortunately, when sleeping patterns start being affected, then we've got all kinds of other problems. And anemia is not an infrequent side effect because of that autoimmune system that's not working very well, okay? Signs and symptoms of RA: P-shaped bumps underneath your skin. X-rays usually show damage, same with osteo. Loss of mobility, soreness, aching, and stiffness, and generally just feel sick. Like you got this low-grade sickness and you just can't get rid of it. But here's something that helps. Getting a blood test from your doctor. Usually you'll find the RA factor is positive. It's a rheumatoid antigen factor. It usually shows to be positive, and that helps clarify which you have. But interesting enough, a lot of the things you have to do are about the same. And here they are again. We're finding out what works, which would be cold, hot packs again. Remember, adding hot packs at the time you have a lot of swelling is just not smart. Neither is the hot tub. Massage seems to help as long as it's soft and gentle and you're not creating more damage. TENS units, again, 10 to 15% seem to help. Chiropractic adjustments are very beneficial because of the degenerative changes in those joints, just like osteo, but again, in a highly inflamed state. Not the choice that I would make at that point. And I know physical therapy does a wonderful job in these situations too. Biofeedback, again, to control pain. Stress reduction techniques to control pain. And here's biggie, because this is as much biochemical. You feel it physically, but it's got more to do with the foods that you're putting in your mouth and the nutritional lacks that you have that have triggered this change in your body. Okay, so keep that in mind. It's usually induced by you over time with bad habits and lifestyle issues that are an issue for you. Okay, haven't you ever seen it? You got this little old lady. She's got big knees and big ankles and a big scoliosis in the spine, and she's out there working on the garden 12 hours a day. This is my grandmother, by the way. And if you looked at her x-rays, she'd be bone on bone. I mean, that knee is bone on the inside part of the knees, both sides. And she'd say they're a little sore in the mornings, but not much of anything else. She ate out of her garden. She made everything she ever ate, healthy as she can possibly be. Didn't eat a whole lot of red meats. And took vitamins and nutrients. And I'm telling you what, died at 93, Alzheimer's, by the way, is interesting. Came on very quickly in her 90s. But before that, this was a healthy lady with terrible looking joints with no pain. Okay? Let's go back to finding out what works. Vitamins, minerals, acupuncture, herbs, homeopathic. Is the exact same list because it seems to work about the same. That something goes awry in supporting these areas, usually you'll find a few of them, if not multiple of them, that makes a difference. Some of you will have to use vitamins, minerals, acupuncture, and magnetic therapy. Some of you will use Tai Chi exercise, homeopathics, and Botox injections. We don't know. Some will use chiropractic adjustments, yoga, and some herbs. Yet you just now, what I'm trying to do is give you the points, and it's right on your notes. Your notes you can review. You don't have to write all this down. But you'll find by experimentation things that seem to make a difference. And once you put them all together, it's amazing what happens. Here again is those most common medications. I can't caution you enough on anti-inflammatory use long term without a protected stomach, but even with a protected tummy, it's really hard on your body. Really hard on your body. And so is acetaminophen. One of the larger causes of liver failure in the entire country are the medications that we're taking. Not because we get liver failure just because we have alcoholics. We like to blame it on that, but the point is, Most of the time it's because of the medications we're taking over time. Acid producing, here's the whole point. I didn't really explain this right before, and I want to make sure we get this. Alkaline-based foods seem to be anti-inflammatory, and acidic-producing foods in your body, acid-producing, seem to cause more inflammation. And that list, this is a short list, but a good list. Red meats, eggs, saturated fats, bad oils, fried foods, sugar, dairy, refined carbohydrates, gluten-filled foods, remember, wheat, barley, things like that, not rice. It's not gluten-filled. It doesn't have a protein that's gluten in it. Excessive caffeine and excessive alcohol. And the allergic foods, as well as the nightshade plants, are something to be considered. And here it is, exact same food groups: anchovies, apples, broccoli, and you can see it right there up on your screen for you to review. Here's the whole point. We have an anti-inflammatory diet. If you don't have a copy, let us know. We'll make sure you get it. The point of it is, if you know what's going to help you long term, guess what's going to happen? A whole different ball game is going to be there. And most of the time what we're putting in our mouth makes a big difference. I can't tell you how many people say, okay, I'll tell you what. You do all this 90 days, follow the anti-inflammatory diet. If it doesn't work at all, just ignore me, never call me, never worry about anything I say again. And by gosh, if I can get them 90 days out, they'll come back in, they'll say, oh, man, I do feel better. I mean, it's so much better, I don't even know. And the point of it is, most of the time, you can affect your health. Now, does that mean you'll never take medications? No, you might need to take medications, but you'll take less frequently, less often, less doctor bills, less costs to the health that right now you're buying things to make yourself sick. Eat these types of foods and you're ahead of the game. And right now, all the nutrients are about the same. You again have to experiment until you find out what works for you. If we look at the herbs, exact same pattern. I can't say enough about DMSO if you have inflammation or swelling. And I can't say enough about arnica gels. They're wonderful for pain control if the pain is getting to you. And remember, you got to kind of find out, is the swelling making me painful, or is it the pain really driving me to the ground? Here's the other thing to remember. In the pain center, we found out that over 90%, 98% that have pain over a year's time start having depression bouts. Some of you be sitting on the couch with your spouse and going, yep, that's it, that's you. You're always hurting. And you know, you're up, you're down, you're moody, you're unhappy, you're happy, we don't even know who's home, Jekyll or Hyde. And you always say, I'm tired and I hurt. Well, do something about it. Take an action step that's going to make a difference. And this type of approach with the anti-inflammatory diet, guess what? Safe, it's easy, it's something that you can do, and something that'll be beneficial for you. I hope this helps. I know there's always questions. We'll continue to try to produce more and more of this information that gets more and more finite, but make sure you have signed up for the free newsletter. If you do not have the accessibility to computer and you can't download those types of things and can't get them sent over the web, just call the office and we will make sure. We usually have a copy of all the articles and everything else, both in audio, visual, as well as in written form if at all possible. Then you can take it home and educate yourself and your friends and share it. Our goal is to save lives. That's the focus of our seminars and our information. We hope you've enjoyed today's session. We'll look for you next time, and may God bless.